Well, today we are here with John Banahan. He's a longtime resident and lawyer here in Pascagoula. And recently he came down with COVID-19 and needed to be hospitalized and was taken care of by the Second River Health System team. John, tell us a little bit about yourself and what being a Pascagoulian means to you.
Well, you covered it. I'm an attorney. We've been here 40 years. My wife and I moved to Pascagoula after I graduated from law school, and she completed graduate school at Ole Miss and fell in love with it. Raised our children here and are blessed that they all came back. So now we're in the next phase and we're enjoying grandchildren in Pascagoula.
We definitely appreciate you making Pascagoula your home. You've brought two great providers to the system, that being your son John and daughter-in-law Taylor. She's an OB/GYN, he's a radiologist. How does it feel to have children who also want to give back to their community?
Well, it's rewarding. We hear, when I guess when my kids were little, they would hear that they were John or Deborah's children. Now we hear that we are Johnny or Taylor or Jessica or Taylor or Abby or Kaylin's parents. Mm-hmm. And so it's a nice feeling. And they're, in addition to Jessica in addition to Taylor, female Taylor in our family, mm-hmm. who's an OB/GYN, and my son who's a radiologist, Johnny. My youngest daughter is a physical therapist who actually worked at Singing River on the 4th floor in the
CRC, yeah.
CRC for a while, and she's doing home health care now, and so she's been more time with her kids. But yeah, her name's Abigail, but we're proud of all of them.
Awesome. So you recently you had contracted the virus, COVID-19. Tell us a little bit about how you thought you got it, and when did you know that you were sick?
I'm fairly sure I know how I got it. I got it from a friend. We were riding in a vehicle together, windows up, no masks. At that time, I really didn't think I would ever get COVID, so right. I wasn't being as cautious as I should have been. But probably 30 minutes in a vehicle together, going and coming, and that's probably where I got it. And he notified me, and when he tested positive, it was right over Thanksgiving, and I was actually out of town, and I went to a lab, and I tested positive, and the viral load was impressive, and I got in the vehicle, and my wife and I drove back home. Wow. So that was how we found out.
Yes, and what were your symptoms like when you knew?
The first 10 days were the typical headache, general malaise, aches and pains. The 10th day is when I got into trouble. I thought I just had a routine case, and then started having some respiratory issues. Went to the emergency department and had a Bam infusion, mm-hmm. and came back home, although the emergency room did offer me the only room that was available at the time, which was in the emergency department. And despite the fact I knew I would have gotten good care there, I wanted to go home. Came home and desaturated that night, and then the next morning came back to the hospital in Pascagoula and was admitted to ICU.
So how was your time in the ICU? Were you scared? Were you nervous?
Just the best time of my life. I really wasn't, I never really was fearful, and I think there are a couple of reasons for that. We had really good care. I said we. Everybody in the ICU was getting good care, and it didn't work out as well for everyone else, I know that. But I had good care, and I had a whole lot of people praying for me. Right. And between the two, I never was terribly scared. I didn't have that impending sense of doom. Mm-hmm. I just knew I was where I needed to be, right, to get better.
So how was the care team in the ICU? What did they do to keep you occupied while you were in isolation?
Brought me a lot of popsicles. I remember that. I don't have a clear memory of everything. The doctors were reassuring. Mm-hmm. Some of them were pretty funny. There's some good folks on staff and some good friends. And the nurses were just exceptional. Not only the nurses, but respiratory therapists took good care of me and did things that really weren't in their job description. They were first rate.
Wonderful. And Dr. Roth, I know you guys have known each other quite some time, being, big names in our community who are doing the good for people. How did it feel to have, your own community taking care of you?
Well, I didn't want to be anywhere but Singing River. Our kids were born there. When we've had medical issues, we've gone there, and that's just where we want to go when we have an issue. I also like to go and have medical care from people that I know. Mm-hmm. So I knew most of the folks that were taking care of me, and in fact, my youngest daughter ran into one of the ICU nurses yesterday at the grocery store, and was still asking about me and all that. So they're still care. So very, very, very compassionate care. I appreciated it.
Always, we're happy we could be there for you, and we'll continue to be that resource for you guys. So after the ICU, how many days were you there, and did you ever do an event?
Didn't have to go on the event. I was in ICU for 8 days, getting lots of oxygen and antibiotics and anything that they could throw at me. They did. I know they gave me everything that the protocol that they had called for. And then I was lobbying probably from day 2 to go to the COVID floor. I wanted a view. The COVID floor is wonderful, except it's a little noisy in those rooms. But by the way, I don't think you can do anything about that. I know they're trying to get negative pressure.
Yes, we actually got a CARE grant this past, I guess it was November and December, and we were able to replace all of those makeshift ventilation systems to be now within one unit. So now it's a little quieter.
Well, once again, my timing was a little off. But anyway, I was thankful that it was working appropriately. But I went on the COVID floor on, I guess, the 9th day, and stayed there until December 28th. So it was total hospitalization, December 8th to December 28th.
So how did you react when you got the news that you finally could go home?
Oh, yeah. I reacted well, not nearly as well as my wife did. I think it was harder on her than it was on me. Mm-hmm. So going home was great, and I was excited about that, and I still am. I've learned from this that things I've taken for granted, I really appreciate, and I think everybody's been through that experience.
What are some of the things that you feel better appreciation for now?
Waking up every day, for one, and the people that you love and love you, and the friends that you find out were worried about you and prayed for you, and quite frankly, people that you didn't even know that were praying for you. So that was, I guess, first and foremost. And then the other is just, I'm walking a lot now for rehabilitation, and just seeing sunshine and fresh air, and where we live is so beautiful. And those are things I take for granted in the past and don't intend to anymore.
That's wonderful. There's some silver linings that have come out of this pandemic, and when you have you're faced with illness, and you it all comes to light of what could happen or what couldn't happen after you go through something like that. And so afterwards, when you leave the hospital, there is some care that you need to get into the road of recovery. Explain to me a little bit about how you were set up through the system to see a pulmonologist.
Yeah, met with. Virtually met with Teresa Williamson, who's my primary care provider, and Teresa guided us through the first part of this very well. I was at home. I was really having some difficulty. My oxygen requirements were still there, not as bad as some folks, but for the first 3 weeks or so, I was pretty much requiring oxygen, and about 10 days ago or so, I started weaning off during the day, and now I can sit here and talk to you fine. I can walk a couple of miles now without oxygen, but I have to remember to breathe. Everybody said the same thing in the hospital, smell the flowers, blow out the candles. So I've been smelling flowers and blowing candles and walking recently a good bit, and that's been helpful. After the first I guess 3 or 4 weeks of that. An appointment was made with Dr. Satala, the pulmonologist, went over to see him, and we're working through what he's prescribed for me now to help with the remaining issues I have with my lungs. But right now I'm very thankful to be where I am, and it was really good care. I appreciate Singing River Hospital and the doctors and the nurses and the respiratory, and the lady that came and cleaned my room that always said she was praying for me. You know, those types of things that I haven't forgotten.
Yeah, we like to pride ourselves. We're a family, taking care of families, and we love what we do. And going through this pandemic, I think everyone can look back and see all of the great things that we were able to accomplish. Some road bumps and lives lost along the way, but I think everybody kind of figured out their calling. This is what we were born to do. With my area, like marketing and media relations, making sure to get the education out there for people to protect themselves, being transparent with our numbers as far as, how serious this pandemic and virus was spreading around our community. So on every angle, from EVS workers to supplies management to, the cafe workers making the good meals for people to keep up their strength, whether they be working or fighting, any kind of disease. It's really just, I don't know, awe-inspiring, I think.
Well, I need to go back because I lost 20 pounds.
Okay.
And I ate everything I could eat that they sent to me. So it must have been good, healthy food that didn't cause you to gain weight. Since I've gotten out, I've gained back about half of that.
But we're walking now, so that can help.
Well, I hope that helps.
Keep
We'll
going.
see. We'll see.
Is there any other side effects that you've noticed that have changed since you've been recovering?
I have little quirky things. You're asking me how's it affected me?
Yeah, like have you noticed anything different since you've had the virus other than your breathing?
Oh, well, there's a lot different. A lot of it's attitude. But as far as physically, I have some little neuropathy at the bottoms of my feet. And I talked to Dr. Roth and Dr. Satala about that. It's just weird stuff, how this virus attacks different things. That's certainly not anything but an annoyance. Otherwise, at this point, it's just my lungs. And then I found out that laying in a bed for 3 weeks can take a lot out of you, so rebuilding strength. And I had some really good care from Care and Home Health, the physical therapist. Get a plug in. My youngest daughter works for them, but they had someone else assigned to me. But built my strength back up to the point I'm comfortable coming back here. This is my 3rd day back on the job, so far so good.
Yes, it's a pretty long process. So you went into the hospital what day?
That would have been December the 8th.
And you came out what day?
December the 28th.
Okay, so right.
And then I was at home until 3 days ago. I came back to work. I went to see Dr. Satala on Monday, and I came back to work on Tuesday.
Are you ready to hit the ground running?
Yeah. The first day was a little weird, but they had a nice little party for me to welcome me back. And then yesterday, I actually felt like I was practicing law again. So that's where we are.
Yes, getting people back to what they love to do is definitely a big goal of ours. So what would you say to the people out there who have said that the virus is a hoax or that it's not real and is nothing to be scared of or anything worse than the flu?
Well, I would hope everybody would know it's not a hoax now, but I have heard a lot of folks, and some folks who are in healthcare even, with some reticence about the vaccine. And I wish they could go, not as a patient, but as an observer, into the intensive care unit for a couple hours. And I don't think that anybody would come out of that experience and be reluctant to take a vaccine that can have some short temporal adverse effect, as compared to where you are and the helplessness that folks have when they're in that situation. So I would, I'm proselytizing, if anybody's listening to this who thinks about this as an issue, please go get that vaccination. Please go get it. I wish I'd have had it. I really do. I would have liked to not gone through all this, and I don't want to see anybody else do it either.
Well, thank you for that. And like they said, vaccinations, whatever cause they may have or effects on you, they're definitely way more mild than the actual disease that they're protecting you from.
Absolutely.
It's good to remember.
I worked for polio and so many other things. So I don't have any reason to think it's not going to work for this.
Right, and technology is always evolving, and thankfully, healthcare is advancing, and the innovation that goes through it, and scientists are getting better and better, at learning how to, keep us alive longer. It's crazy, but it's different, but it's a good different. Things can't stay the same, and it's good to try new things, and I trusted that scientists would keep us safe.
Yeah, I'm waiting to clear so I can go get my first shot.
Wonderful. Yes, me and him were both fully vaccinated. Thankful for our health system to providing that to us so that we can keep doing what we do. And was there a message that you wanted to say to the team at Singing River about their care and your appreciation for what they've done for you?
Thank you very much. I wouldn't have been anywhere else if I'd been given the choice to go to Johns Hopkins. I wouldn't have gone. And my faith in the system was borne out, and I appreciate everything that was done for me, not only me, but for my family. So thank you.